How to protect your nursing license in the wake of the RaDonda Vaught verdict. How can I be sure I'm not the next nurse to face criminal charges for a mistake? Medication-related errors are the most common mistake made by nurses. Forming solid documentation habits can provide a framework nurses can use to defend your nursing judgment and interventions. How common are medication errors in nursing? The case of RaDonda Vaught has captured the nation's attention in recent weeks and has nurses asking, how can I be sure I'm not the next nurse to face criminal charges for a mistake? Vaught was criminally prosecuted for a fatal drug error and convicted of gross neglect and negligent homicide last month. Medication-related errors are the most common mistake made by nurses. While the true number of medication errors can only be estimated from what is documented, the prevalence of errors found in patient medical records is staggering. One study assessed patient care records and analyzed the errors found. An estimated 41% of all charting errors at one hospital were related to the wrong dose of medication administered. The next most common mistakes found in documentation included charting or administering the wrong medication, followed by the omission of an ordered medication, failing to discontinue care plans that were no longer applicable, and charting routine care such as hourly rounds before they were scheduled to occur. Medical documentation not only helps ensure compliance with policies and procedures designed for patient safety, such as the 6 rights of medication administration, but also helps protect your professional licensure and provide a defense during any potential future investigation. Is your documentation thorough enough to defend your nursing judgment and interventions? While examining documentation habits of inpatient care nurses, researchers have found a tendency for nurses to feel more competent in their documentation efforts than what is supported by their patients' charts. Even if you feel confident that your documentation practices are sufficient, there still might be room for improvement. Could more attentive documentation practices have made a difference in the outcome of RaDonda Vaught's case? Standards for documentation exist to keep charts up to date with pertinent data, which improves patient safety and continuity of care. Just as good documentation habits enhance the care of patients, they also can protect those who provide the care by supporting decisions made with data that may be long forgotten by the time an investigation occurs. It would be unwise to hypothesize about alternative outcomes without having been present during the patient care activities Vaught performed. However, it's clear that using documentation as a framework for planning nursing interventions can help increase patient safety. Given a similar scenario in which it might be necessary to override a medication in a dispensing machine, like Pyxis or Omnicell, establishing a standard safety measure of documenting a secondary verification of the medication removed from the machine could serve as an additional reminder to perform an independent double check of the medication vial with another nurse before administering it. Regardless of their overall prevalence, every single patient care mistake has the potential to be catastrophic. Taking the time to follow standards of care and patient safety protocols is critical even in the chaotic culture of today's bedside care. Forming solid documentation habits can provide a framework nurses can use to safely plan their entire shift. Thanks for watching our video. If you want more information, please visit our website chartnote.com.